Hi, everybody. Good morning, good evening, good afternoon, wherever you are in the world. Welcome, welcome. My name is Jasmina from Jasmina Brosvik Astrology. Today, I have special guests and such an interesting and most needed topic. I have Dr. Maria Johnson with me and Jaymie. Jaymie, you probably know from my previous video, we talked about boundaries in astrology. So, welcome, Jaymie, and welcome, Maria. I'm so honored and happy to have you here. And why we need this topic, especially now, is because this year, astrologically, as many of you know, is very turbulent. A lot of shifts and changes are coming, and people are just scared of change. They don't know how to deal with it, and energies are all over the place. So, with the help of some medical advice, I think we can push this year through with a better awareness and knowledge and with more brave courage, let's say. Uh, so welcome, ladies. Thank you so much for joining, for taking the time. Maria is a doctor, an MD, and Ayurvedic doctor, practitioner, and astrologer. She combined all her knowledge to help people thrive and live more fulfilled and healthier lives. So welcome, Maria. Please tell us how did you combine all of this? What brought you here where you are today? I'm so curious.
So thank you, Yasmina. Hi, Jamie, for having me. It started many, many years ago. For years, I got very ill because of hepatitis. And I got hepatitis through actually a syringe that was actually contaminated. And I have physicians, I have psychics, I have one astrologer in my family. So I grew up in that environment, very weird. And I am anyway. They were calling me the weird doctor. I don't have any problems with that because I rather be weird than normal. What is normal nowadays? And I started with astrology merrily as fun. I was about 14. And then, excuse me, I'm a little bit ill at the moment. And I left it for at least 1 decade. And then I started to combine medicine because I am a certified doctor in Italy. I'm Italian. I did study in Italy. And astrology was a part of the study until the 15th century in Bologna. Then, of course, the Catholic Church decided that that is evil and should be banned. So they took afterwards astronomy, and but the Spanish carried on until about the 1700s. So it's nothing unusual. It's even the Greeks. It's actually in Greek. It's called iatromathematics because astrology is mathematics. So
Yeah.
I started to with myself. "Oh, I have to give it a try, but just for fun. I didn't know the outcome. I started with my family first, then with myself. I wanted to know what was the transit. Perhaps I will find out when I had this hepatitis stuff because I was ill about half a year. And hepatitis is actually the inflammation of the liver. Why did I say?
There is some background noise. I don't know, Jamie, is it from you or from you, Maria? There's like a
I
background noise.
I don't
No.
have here any,
Okay.
not at all.
I'm in the hotel by myself. I don't know.
Okay.
So
I'm
Okay.
sorry.
Okay.
I started with myself, with my kids, with patients. Of course, they gave they're okay that I'm allowed to use whatever and to see for my studies if I can find out. And it started slowly but surely. I was getting answers, but it was always only a study for myself. I didn't go public until when was it, 2021? Because people think anyway that you are crazy. And how dare you? I got even a friend of mine, a doctor. He said he was telling me you have lost your marbles and you should be ashamed of yourself. And how dare you? I said, listen, do go about your journey. I have my journey. If I can help people uh, actually treating the cause of a
Yeah.
malady and not the 125 symptoms that we create because we give a lot of medication that they don't need. So please stop it. And because
Yeah.
this is, I mean, we have seen it the last 4 years. And I stopped working for the establishment. I call it establishment. Actually, perhaps 3 years prior to this pandemic thing, and I had enough. I could not go along with my conscience. I said, that's it, I'm done with it. And I lost everything. I have to be honest. I had to start from actually ground zero. But my conscience was afterwards. It took me 3 years to build up. At least I can sleep at night. And
Good.
my duty is for as a doctor, it's our duty that you are getting, if you're ill, that you're getting healthy, but that you remain healthy. That is our job.
Mhm.
Sorry if I get a little bit
Yeah.
agitated, but it's
Yeah. And I understand. Like this holistic approach or individualistic approach is very important. Not everybody. If each of our DNAs is different, why would we have the same treatment? Doesn't make sense to me, right? It's just
no, it
Yeah.
doesn't. It doesn't
yeah.
make
It's
sense
just
at all.
yeah. So how did you implement Ayurvedic practice with this?
I started as well Ayurvedic
Hmm.
medicine. And there I understood, actually, I have learned more from Ayurvedic medicine because a PhD told me off. He says, you know nothing about medicine. And I said, how dare you? I'm a double Aries. I don't take anything. How dare you? And I leave the university. This is outrageous. But I became one of his best students. But I had to understand first what he
Hmm.
wanted to tell me. That you have to treat the human and
Hmm.
not the malady. And by the way, each sickness has a certain vibration, and we don't think about it. It's there. Everything is vibration. We are vibration. And if
Yes.
you have a malady, say a severe one, that the vibration is very low.
Yeah, I agree. Like we are part of the universe, a part of energetic systems, just whatever that they are, and we are, like anyway, you don't want to go into that, but that is definitely true. So taking care of our bodies is important, but also our mind as well. Right. So I know. Oh, did I freeze? Okay, I'll have to unfreeze. Before I unfreeze, JB, can you just tell us a little bit about your project? What are you doing to get to help people with their bodies and their minds together?
Yes. So Maria and I decided to combine forces, and so we have a collab called Astromedic Insights, where Maria blends the medical astrology, the medical aspects of things, and then I combined the emotional, psychological, and spiritual layer of things. I have been trained in medical astrology, but I don't have a medical background. I have been a medical researcher. I wasn't supposed to be. I was a general researcher. They transferred me, and I was so young, I didn't realize I wasn't allowed to not know what was going on. So I just modeled off of the other researchers. And I have a lot of friends and clients who are med and psych students and stuff. So I've helped them through med school until they got to organic chem. So I'm not saying that like I obviously don't have a med background, but this is something that I'm really passionate about. And like every so often, I used to troll Maria and have like, and I'd be like, "When the fuck are you gonna start your medical astrology course?" Because I've benefited from the other courses. Don't get me wrong, but there are certain things that I learned in those courses where I'm like, well, that's not medically correct, or it's a little distorted, or something is off and stuff. So I was like, really, like, I wanted so much for something like this, something like someone with Maria's background to teach medical astrology properly. And so I was really excited when this is something that she expressed that she wanted to do, because we've done collabs on my YouTube channel before where we talk about like the 8 different components that make up the nervous system, things like that. And I just love this. Like, it's in my chart. I have a background in my previous incarnation related to like medicine and astrology and stuff. So it's a really important thing. And Maria adds this wonderful layer. But I also think that in addition to having the information, like Maria said, you know, everything has a vibration. And for every physical symptom, there's an emotional, psychological, and spiritual root cause that, especially the more chronic something is, that's been like that root cause hasn't been addressed. And so exploring that is really important. And I think there's like two layers here where I think that a lot of times when people are experiencing chronic conditions, they kind of overlook the emotional, psychological, spiritual root causes with the mindset of, oh no, mine is chronic, like that other stuff, I've gone too far. When it's actually the opposite. The more chronic it is, the more important it is to address those root causes. And I think astrology has a great way of identifying that. And also, I think when people are struggling so much, it's not just the information that's important as far as like, oh, like these are the types of meals, or this is the supplement that's good. Like, even though it seems straightforward, our nervous system and our life sometimes makes it difficult to make those changes. And so I come in there and I layer in insights from this is the best day, the best time, the best way, the best type of meal prepping to really make it user friendly. Because I've also been a home chef, a personal organizer. I have a lot of stuff in my life.
Multi-version, multi-talent.
Exactly.
I think your Jaymie, I think your microphone, when you move your hair or something, that's why we hear this from the that's a back sound.
I don't. Do you hear anything? I mean, I don't have a mic, but is it better now? Or?
Yeah, it's better. Sorry. Okay, so this medical course, I just a few pointers about for people who don't know about medical astrology, or how can astrology help us in a medical way. Can you, Maria, tell us just a few pointers or what people can expect from this course, and just what is the connection between medicine and astrology?
Well, I suggest that people have at least a rough idea about medicine, because when I do an assessment, I give my medical part first all the time, regardless if it's astrology or not. Afterwards, I combine both. Okay, so medicine is, if you have any, even if it's a little percentage of knowledge, because I don't expect the people actually learn medicine or study medicine, because it's quite a little bit a headache. It's a long time anyway. And astrology also, you don't have to have the highest knowledge. And what those drives me mad sometimes, the people speak about, say, for example, Aries, yes, the head, and Taurus is the neck, and so forth. It's not only that. It goes beyond that. It goes beyond why. I am an Aries. I'm a double Aries. So I have to look at the axis of Libra, the axis of Capricorn, and the axis of Cancer. There I would be affected for sure because of the ascendant. If we don't know the ascendant, we have the possibility to find out. It's a little bit a headache to find out, but I have had people or clients that they didn't know about their time of birth, and I could find it out. It's a special program for it. And then combine everything together. As I said, I give my diagnosis, but I cannot expect from a layman that do a diagnosis, but they can at least understand the medical astrology as such, because it's you start from zero.
So what is this course? How is this course going to look like?
Well,
so
you can explain it, Jaymie.
Yes, please.
So we have a Patreon channel, and so we have different tiers. So we have the medical course, and then we also have two other tiers as well. So with the first tier, it's going to be a monthly call where we're just going to be talking overall about astrology and medical astrology. And for that one, it's going to be one call at the beginning of the month, and we're going to be focusing on that one's going to be very general. So it's going to be a little bit about some information about like the zodiac sign that the sun is in, giving some information about that. And each member is going to get a chance to ask one general question. And so you kind of get a little bit of some insights there. And then in the second tier, it's going to be a weekly call where same concept, we're going to be covering things, except at the beginning of the month, it's going to be just a little bit about some medical insights about that zodiac sign. And then the second week, the third week, and the fourth week, we're going to be covering the emotional side, the spirit, the psychological, and the spiritual. So one of those topics per week. Same thing, every time we have a call, each member will have an opportunity to ask a general question. And any subscribers who want to ask additional questions can pay for that as well during the call, which will be discounted. And then the medical astrology course is going to be a lot more in depth and stuff. That's going to be we're still kind of working on that one right now. Like, to kind of simplify it, we have like a layout of each zodiac sign, like what they generally cover and stuff. So like right now we're in the Aquarius season, things related to Aquarius, things of that nature. You know, we were supposed to start in Capricorn, but we didn't get a chance to. And so things of that nature, and that's going to be broken down a lot more. But there's so many things from what Maria mentioned that's going to be included. That's related to the angular houses, the midpoints, the degrees. I mean, there's so many layers. It's not just about like, there's that foundational aspect of each zodiac sign ruling certain parts of the body, certain parts of our body system and stuff, which is something that a lot of medical astrology does cover, but going in a little bit deeper, you know, and not just about, like, a lot of times people will be like, oh, the liver is Sagittarius, but it's also part of the liver is also related to Virgo. You know, when Maria talks about the brain, certain parts of the brain, it's Neptune that what rolls amygdala. Like, there's certain things that you can really get into, get very deep, very specific. And so there's stuff that's like universally helpful for everyone. And then there's information that's unique to every individual that we'll be able to get into.
Excellent.
So, like,
that's very helpful. That's very helpful because you're looking from a lot of different angles, right? Literally a lot of different angles you're going to cover to help people. Okay, so just give me a glimpse, because I'm curious, Gemini. What would be like advice in general for people now? I know we are coming to eclipse season and we have this strong Piscean energy, and it can be overwhelming. It can be, you know, people can be more depressed than usual, or just, you know, more overwhelmed. So I know it's general, but what would you maybe just advise people to help them to go through these eclipses and this strong Pisces energy? Maria, would you like to start?
Yes, with Pisces we have to be a little bit careful because it's delusion most of the time, because it's also the universal love, put it this way. Mental health, I see a little bit of problems. Thanks God, Saturn is still there to give it a break, put it this way, or to give it's grounding. Sorry, because I'm thinking in German and I try to find
Nope. Take your time.
And it gives a structure. And I'm not so happy that when Saturn will leave, especially for Pisces, because of that structure that it will be missing. Okay, it's not that the world is ending tomorrow. No, not because I don't like the gloom and doom stuff. I say the things as they are, and for each individual, even there are billions of Pisces, each one is different. Okay, but in general, it's water. The water also that we have inside, partially also the emotion is not only Cancer. Okay, the lymphatic system, and because it's in opposition to Virgo, as Jaymie said
Mm-hmm.
also, it's part of the liver lobe and
Mm-hmm.
a part of the pancreas as well. It's not only the ribs and this and that. It's very complicated because we have to look for Pisces as well, Sagittarius. That is actually in a square,
Mm-hmm.
okay?
Mm-hmm. Yeah.
And is in a square with whom? With Gemini.
Mm-hmm.
So these four signs we have to look closer. For Gemini, because Uranus is very erratic, the nervous
Yeah.
system. You have to be very careful that you don't overdo everything because
Mm-hmm.
otherwise you can't sleep. You can't do anything properly.
Yeah, yeah. So
You
with Uranus coming up, yeah, in Gemini, it's going to be a lot of nervous system for everybody. We're all going to be kind of
Yeah.
wired to higher something.
on overdrive.
Yeah.
We will
Yes.
be on overdrive, and that is if you know in advance because this is actually preventive medicine if you want so. Then please do something against it if you know already in advance and not be surprised. Oh, why do I have now problems with my nervous system? And by the way, nervous
Mhm.
system, you can take vitamin B6 to strengthen it.
Oh, that's a good advice. Yeah,
Yeah.
yeah, yeah. I like that.
Vitamin B6, and
We,
but you have to take it daily, not today you
yeah.
take it and then 2 weeks after. You have to take it daily for at least
Hmm.
1 month.
Okay. Well,
Yeah.
excellent. Jamie, what do you want to add for this Pisces
Yeah.
Gemini energy?
Yes. So yeah, like we have a lot of Pisces, Aries activation going on.
Hmm.
I guess some of the good things about Pisces is that some of this Pisces like energy is a rerun with Saturn and stuff like that. Like for me, I'm more from like a medical perspective, thinking about how with the North Node conjuncting
Hmm.
Neptune and stuff, there can be maybe an excess of like allergies and stuff, more
Hmm.
whatever it is that we're more sensitive to is going to flare up. And I feel like it's going to be tied into our nervous system. I'm a Pisces sun, so this is something that I'm like very aware of and whatnot. I natally have my North Node in Gemini. And so for me, one of the things that I've done that's really helped me out is with Saturn being in Pisces, like using that energy of repetition, using prayer and stuff as almost like a boundary setting, a protection, just sort of strengthening that, connecting with ourselves, asking for support from our spirit guides, because we do have a very strong Pisces energy, and that there's things related to Pisces and Neptune in medical astrology that's very much sort of using that energy of meditation, support, napping, and stuff like that, I think would be so great. And also, I've been, and Maria knows this, is like I've been like so obsessed lately with like um, trying to regulate the nervous system and really exploring what that looks like for every individual, whether it's somatic, Feldenkrain's, kind of tapping.
Hmm.
And with the South Node of Virgo, really just looking at like what are some of your health challenges and really actively looking at practical ways. What are some ways that I can clear those things up? Because this is going to be a time where we can really activate that emptying out energy to make it easier to do that. So it's like, even though we do have more triggers with vulnerability in our nervous system, I feel like everything is being more exposed. So
Oh,
things might,
yeah.
it'll be easier to kind of clear that. And
I
something
mean,
else I did, I'm
mhm.
sorry.
No, no, I was thinking we need to protect our energy. That's
Yes.
definitely important. Go ahead.
Yeah.
Jamie, if I
And so,
may add also, we speak often about do a detox, do this and that diet, and you name it. I don't
yeah.
know. Please be aware before you do any detox.
Yes, yes,
You
yes.
have to get rid of parasites.
Yeah.
Wow.
Parasites are actually also very often the cause of serious, and not only serious illnesses. We have
Mm.
many people with parasites. You can see it also with animals. So do a cleansing in it first,
Mm.
in killing the parasites, and then afterwards you do a detox. And
That's
be
Yeah.
great.
careful when you do also a detox, because that drives me also nuts. When you do a detox, you have to be sure that you replenish your body with vitamins, with
Uh-huh.
because otherwise you are flat dead. I mean, not dead, but flat because you're flushing everything out.
Yeah.
Okay,
Yeah.
that is very important.
Yeah,
Yeah.
and that's a big thing is that there is a hierarchy, and something that I noticed is that like everyone nowadays on the internet is like, oh, do this, do that. And it's like, yeah, certain things are going to be good for your body, but if you're detoxing and you have all these toxins and you're flooding and you're exposing yourself, you can like it's almost like the idea of re-traumatizing yourself, re-sickening yourself almost. So there's definitely an order that's good, and the way to do it is different for every individual. Should you be fasting? Should you not be fasting? You know, some people do better with like a higher level of detox dosage. Some people really need to microdose it and stuff. But something that Maria said that I did also want to mention is that there's definitely universal things that we can do. And like on my YouTube channel, if any of you guys are interested, we did talk about like 3 detoxes that everyone can do, some general food and nutrition guidelines and stuff. But it's also just more than that. Like in my chart, for example, like I have indicators, like I know misbehaving mentioned
Yeah,
having an okay,
oops,
perfect. Yeah.
I'm gonna put her on after you finish your thought.
Okay. So yeah, and it's like for me, because when you mentioned Sag, I was like, oh, okay, like because I'm a Cancer rising, I have Uranus, which is about unpredictability in my 6th house. So when it comes to my health, a lot of things are really unusual, uncommon, or if you're a Leo rising and you have Neptune and Capricorn, there's a lot of like confusion going on. Mine is unpredictable. And so the recommendations that work well for me go against conventional medicine. Like I have certain like supplement, like vitamins and minerals where I do better with a higher dosage that's qualified as like poisonous levels. So this is where the personal stuff can be really helpful. I've spent years just being deficient with certain things, and eventually I gave up on supplementing because I was like, it's not worth the money,
It's not
only to
working.
realize you take way more, like way more.
Yeah.
So,
Okay.
yeah.
So Misbehaving is here. Thank you for joining. She goes, I've been diagnosed with a rare, serious autoimmune disease. She has Sag, Sun, and Moon, North Node in Sagittarius and Libra rising. And it says it took a long time to get diagnosed. It was so frustrating. So what can be a cause of autoimmune disease in general?
Are you talking to me?
Maria? Yes, Maria. What do you feel like? Why does autoimmune diseases come up? What is happening? Is that
Well,
something
that can be genetic. It means
Mm-hmm.
that you have it already in your genes. I have people, I've noticed Pisces, Ascendant, and Neptune, they are, for definite, they have allergies. They will always have allergies. But it's not said. That means also, don't ever forget, when we do a natal chart, and this natal chart looks beautiful with all these planets and colors and this and that, this is the blueprint. But we have to look closer how the planets talk to each other. And sicknesses most of the time get triggered by transit. They can stay the entire life dormant, that you don't even know that existed. And suddenly you get really out of the blue, you get this eczema and that allergy, and
Yes.
perhaps this person ate something that she didn't know she was allergic to.
Yeah.
So
Yeah. You reminded me of my aunt. She all of a sudden, like she was she was almost 60, I think. All of a sudden, she's the fish allergies. No fish, no shrimps or anything. Just all of a sudden, like she was like, "What is happening?" So yeah. So it's something with
that means
transit,
that her
probably.
body
Yeah.
is producing too much histamine. That's why she got that allergy. But I had many patients that I could saved their lives because we knew it's actually an anaphylactic shock. If it gets
Ah.
really bad, it's an anaphylactic shock, and then you have no time to discuss. You have just do whatever you have to do to
Yeah.
save lives. Yeah.
Yeah, that's interesting. Before we go on, I just want to say hi to Consuelo. Hi. Thank you for joining. So if anybody watching has a particular question, or they have some medical issues, they have been struggling or not being diagnosed properly, many people, today they just don't get the diagnosis on time, proper diagnosis, because the way doctors approach. So please contact Dr. Maria or Jaymie and make sure that you get just to understand what's happening. So I know, so usually people that are confused about their medical condition have like some strong Neptune placements or Neptune in the 6th house, or right, so they can be allergies and autoimmune diseases. So it's Neptune usually involved, right? Yeah.
Pisces
Or no.
rising, Libra rising too, because then you have Pisces in your 6th house. Yeah. Or like if your moon is aspected to Neptune too. Or, and as me, I have Uranus in my 6th house. So it also depends on the generation. Like mine isn't so much confusing, but it's unusual. So a lot of times, like with Western medicine, it's very much, it's a diagnostician. It's like you're trained to be a diagnostician. So unless you're like very much like you meet that statistical quota and stuff, like even if you don't have confusion in your chart, if you don't meet that quota, then you're not going to meet it. And then there's so many different levels from like the way Western doctors do it versus naturopaths, like the levels that are considered like good or bad vary and stuff. Legally, if a doctor says you're in a normal range, that's basically based on their standard and subjective. It's all these different things. Like
I know, I had a situation like I have taken my blood, and so I gave it to the regular doctor. They just called me, oh, okay, nothing to worry. And then I gave it to the same blood results to my naturopath, and she goes, come here right away to see me. Like it was just the reaction.
Acupuncturists say it differently. The different countries say it differently. And then it's so different for every individual.
So I do really feel that people it's not a point of having second opinion, it's having a second source. Like you need to have literally so yes, I think your approach can really help a lot of people. What else would you what else do you want to talk about to help people or to clarify today? Jaymie, do you want anything to add?
Yeah, I would say, so I go by my, I have something called the 4 pillars of health. And in order of importance, these are things that I prioritize. I stole the idea from my yoga instructor. So hi, Mike, if you're watching. And I kind of tweaked the order. I would say it's breathing first, then sleep, nutrition, and body movement. Because I feel like a lot of times, people get stuck on, I got to make sure that I meet my calorie content, or I want my CBD or my supplements, and these are all important. But if you're not breathing, this is something that's free and accessible to everyone. There's different types of breathing that's really good. I'm prone to forgetting to breathe. So I'm like high on CO2, low on oxygen. So there's certain, and like an early ADHD diagnosis. So there's certain breathing that's good to help with that, but then it makes me dizzy. So I had to do a lot in figuring out like what breathing is going to be good for me and stuff. And there's definitely stuff that like Maria and I can support you on in regards to that. But even just like your own research, you're setting your alarm to doing this. And also sleep. I think people normalize crappy sleep and neglect it and stuff. Even just looking at your 12th house, looking at like what environment is ideal for you to sleep. I think people forget about the 12th house, even though it's our most vulnerable house. It's so important. Creating that environment that helps you sleep. And also your nutrition. Maria has a nutrition plan reading available. So that's the other thing. Yeah, holding our breath.
Everybody does it,
Yeah, no, it's totally a thing. And so like, so another service that Maria and I offer is a combination of our readings and stuff. So like there's like the nutrition reading, there's one about teeth analysis, but whatever reading that Maria provides, I can provide like the ways to implement it into your life and things of that nature. But nutrition, I think, is so important because like, I think your quality of the food and the intake determines the kind of exercise that's really important. And I recently read something that said that the reason why some people aren't compliant with going to the gym isn't necessarily because you're lazy. It may just be that like you haven't really conformed. And it's not natural in evolution. Like we used to exercise out in the wild, so going to the gym isn't natural. So for me, that's not something that's natural. And just really looking at and being honest with what body movement is actually good for you. I think people have this stigma that you have to do it this way, and that's not always the case. And that's why medical astrology is so beautiful. Story?
No, you reminded me. I heard a story, and it's like an exercise story that I heard, and I found very interesting. They did a study. I think, I don't know, somewhere in the US probably. They had like a 2 set of housemates in the hotel. So for one group, they told them, this is your regular day. You have to do what you regularly do. And they felt exhausted after. To the other group, they said, look, everything that you do today, you're actually exercising. Your cleaning is your exercising. So they went with a mental thought that they were exercising. And after a month, these people were much more rested, happier, even lost weight. And these are just, they were exhausted, the first group. They did the same job. Nothing actually physically changed, but just the coming, the mindset of, cleaning is also exercise. As you said, it's more natural because you literally are doing physical work. You don't think of it. Right. So just so now every time I do something around the house, I'm like, I'm exercising. My Virgo rising. I'm like, yeah, I'm exercising. I'm thinking of that all the time. So it's interesting how just, here and there, when we hear something mentally, can really like here, if we change our mindset, it can help us a lot with our physical and stuff. Also a sleeping story. Just before Maria, I just want to say one sleeping story, and then I'm going to let you, Maria, talk. Like I was scoring my sleep, and it was like I slept 8-9 hours, but I felt tired in the morning, and then my cortisol levels were so high. So it doesn't matter, how long you sleep, it's how you sleep. So people forget about it, right? So anyway, Maria, please go ahead.
What we also should consider, I don't say you must do it. No.
Yeah.
I think that we really should consider. It's yes, we do a detox from our body, from this beautiful vessel that we have for this planet. Is actually the extension of our soul, our higher self, this beautiful body. But what about our brain? Our brain is actually the control tower, put it this way, for our body. Okay, and why don't we do sometimes Control Alt Delete and get rid of old data that we don't use anymore? It's not helping you to grow, and also for your well-being. You just Control Alt Delete. That's it. I do it every often. I also forget, but I say to
Maria, that is beautiful. Maria, imagine cleansing your mind, because we cleaned our drawers and we clean our cupboards, we clean everything, but we don't take, the old duster from our heads, right? When you do let's clean our environment. This is the first one you have to start with. That's amazing. It's harder. It's harder, but it's possible. That's what you're saying, and it's important, right?
Absolutely, because you take things that happened perhaps 30 years ago. What does it change? Nothing.
Yeah.
You can have grief and you can cry about it, but it's gone. It's no longer there to help you. That's it.
Yeah. So guys, you heard first, spring cleaning has a new meaning. You have to spring clean your brains.
That's so important. It's like we forget that like our entire body, our head is just this tiny little piece, but we have so much activity up here. And I actually texted Maria, like it was like in the middle of the night for me, and I became like obsessed with the brain. And this is another reason why like I really want Maria to do like this medical astrology course, is that like in other courses and stuff, they're like, oh, there's the head, or they don't really break down the brain. And so she sent me this information where there's like 17 sections to the brain, which is belonging to specific planets and degrees and all important, because this is something that maybe misbehaving like you might find interesting. I don't know your story about holding your breath, but I have this whole theory with me where because I unconsciously, even in my sleep, I don't breathe regularly. Like I had an ex who put a mirror under my nose because he thought I was unconscious, and he was like, you breathe only once a minute. So this might be a conversation we'll talk separately also, Maria, but I kind of think like on a subconscious, unconscious level, I'm like, just knowing my history, I'm like, maybe I have some brain damage, which is affecting my ability to breathe properly, because breathing is supposed to be involuntary.
Yeah, Jamie, it's called sleeping apnea.
Yeah.
Oh no, it's not. No. So I haven't been diagnosed with sleep apnea, but even like when I'm like awake in general and stuff. So I'm not. I mean, I don't know. Like,
It's
flat. You're breathing just flat. You're not breathing deeply. But you're not the
yeah,
only one, Jamie.
yeah,
Many are not able to do that. Go
yeah,
outside into the woods, have a good fresh
well,
air, and
Mm.
and try to breathe as much as you can to open your
yeah.
lungs, and
Well,
then
I
you
also don't breathe regularly either.
know
That's
you
yeah.
are
So
not. You have your autonomic nervous system. It's uh,
yes,
uh,
exactly.
it's not
Yeah.
that used to it. Put it this way.
it's
Exactly. And that's what I'm telling you, you guys, it might sound elementary, but set your alarm
no.
and like start breathing. Like,
Yeah, it's
it sounds
interesting.
crazy, but we need to do it. It makes a
Yeah.
huge difference.
No,
And my
it's
friends,
you're on
yeah.
point. You're on point. Yes, we don't know how to breathe. We forgot how to breathe. Oh,
Yeah.
so misbehaving is asking that might be the central
The
nervous
central
system
nervous,
thing.
yeah, your automatic nervous system. So breathing is supposed to be involuntary, but like it can, because of like our stress level and stuff, it can kind of change our conditioning. But if you want to explain that a little bit more, Maria.
Well, it's actually the autonomic nervous system, but it can become, put it this way, a central nervous system. So it's a mixture. I have to look, if I wouldn't know more about the patient or this lady, I could look deeper into it, because I don't like to say yes, it's this, and
Yeah,
that
yeah, yeah,
is
yeah.
not. I don't like
Yeah.
that. But
Yeah.
it's the central and autonomic nervous system.
Yeah, yeah, yeah. Excellent. Yeah. So there's like breathing is number one, guys, and it's free. It's available.
Yeah.
I mean, you need to breathe. So yeah, I love your four pillars, Jamie. I think that's beautiful. All of us should think about it, how we use it, and some great advice for upcoming Pisces season and for Uranus. So you heard it here. Maria, do you have anything that you want to add before we wrap up? Do you have any closure
Oh, can
word?
I make a request, Maria?
Yes, yes, please.
Do you want to maybe share like I know it's like different for everyone, but like what are like some health issues, like what are some health practices that you do every day? Like I know there are certain supplements that you take or something that you
Yes.
recommend that will be beneficial for everyone.
Oh, I like
Well,
that.
I have been neglecting it since Wednesday because I was flat. I had very high fever, but normally when I don't forget and because I usually preach to others to take them, and I am one of the worst patients ever. I admit it. I'm only human,
Aries is non-compliant, you guys. Okay.
but I take very high dosage of actually vitamin B12. Um, um,
Energy.
zinc is very important. Folic acid.
Hmm.
Then what is the other one? Because I'm thinking in German. Sorry, I have a picture. Then vitamin C, but I don't like very much vitamin C. I dump it perhaps one day, I leave it out, and then I take it the day after. And one that product that is actually uh, recharging our mitochondria, and
Yeah.
Mm.
it's very, very important because it's the mother of all cells. It's nicotinamide riboside that
Mm.
you can get everywhere. I have what is it, 900 milligrams per day, and as well shilajit that is helping with 84 different minerals, and I mean something from the Himalayas. And
Wow.
perhaps I have forgotten something, but this is the overall story. Put it this way.
Excellent. Jamie, do you have any of your did you want to share? What do you take daily?
I mean, for me, like I mentioned, there's certain dosages that I need to do a little bit higher. So
Okay.
mine are a little bit unique. But like a lot of people are deficient in vitamin D, which is a hormone. And generally, when you're deficient in vitamin D, you're also deficient in vitamin A. There's a lot of stuff with certain supplements where it's like you can't take them together, or if you're deficient in one, there's like there's usually a deficiency of another. So I personally take really high dosages of those. I'm not suggesting that other people do, but if you are deficient in vitamin D, taking vitamin A is also really helpful. And you guys, zinc has been such a game changer. It's, there are people, a lot of women are iron deficient, and some of it is just that your body isn't able to use the iron that's actually there. There's your main iron, there's your backup iron, but you could have all the iron in the world. If you don't have zinc, that's messing with your hormones, your immune system. And a lot of people are ADHD, autistic. It's like we have a more sensitized brain. And so with the mitochondria that Maria was talking about, it's like a process that our body goes through constantly. And people who are neurodivergent, pretty much probably people who are interested in astrology, let's be real, ADHD, autistic, all of these like things, we need more support. Zinc can be such a huge game changer. Everyone talks about magnesium, and don't get me wrong, that's important. But I feel like for me, zinc is the thing that really changed my life. But I had to take a high dosage. So if you do that, like make sure that like you're not having it on an empty stomach. Any thoughts on supplements or menopause? It really does depend. I want to be cautious in giving recommendations. I can share my personal story really quickly because I've been diagnosed with endometriosis, which is a reproductive disorder that causes really excruciating menstrual cramps and reproductive challenges. And so it's a little different for me in that, like with menopause, estrogen drops. With mine, I have an overload of estrogen, but there are certain supplements or herbs and stuff that like they actually are more of a regulator and a harmonizer. So whether you're deficient or overboard, there are certain things that you can take. I'm a little cautious in recommending what's best for you because honestly, the ones that are best for me, like literally, they usually say you shouldn't take because they're like it's a little aggressive for you, and that was best for me.
That is true. I can confirm that. I'm going through some kind of premenopause, something, I don't know. So last couple of years I've been, working with my naturopath to figure out what I need. And I finally last year, I'm so happy with, because we were trying so many different things, and zinc is one of them, and black hawthorn, and I had a bunch of ashwagandha. I don't know. There's a lot of things that, my body needed. And because I also
ashwagandha
had endometriosis.
Is a safe one. It's a pretty universally safe one.
Yeah. And I had
with that.
So I also had endometriosis, and I had a surgery when I was young. So there's like a lot of hormonal things, and I would suggest that you definitely consult Maria or Jaymie or any naturopath in your. I really suggest that because modern medicine, they don't have the solution for these kind of things, not yet. They can, if you need a heart surgery, yes, go to the I'm not going to say that you go to the naturopath for a heart surgery, but for prevention and for prevention 100%. And for just life being like my life changed because a couple of years ago I almost killed my husband and my son. I was so nervous. Like this, no, it was really like I was like possessed.
No, this shit is real.
Like it's possessed. Like I wasn't me, like this is not so giving your life a balance. You need to find of course diet is important and movement, everything, but I just feel getting balancing
stabilizing
your body. You need individual approach. That's what I'm trying to say. That's why, very important. Yeah,
exactly. Well, and I don't like recommending what works for me because what works for me is what usually doesn't work for most people.
Yeah, it doesn't.
But like with chronic health, Eastern medicine tends to be a little bit better. Now, don't get me wrong. If I get shot, I don't want to go to a Western doctor. Like Western doctors know what's up. Like I don't want to get shot in Japan. Like nobody's gonna know how to like save me. They don't deal with bullet wounds. I'm gonna like die of an arm wound or something, So, but yeah, definitely looking at that. And I mean, I'm like, how much time do we have? No, I'm gonna say.
I was gonna. It's fine. We're gonna kind of close up. But the general, you gave general. There's a lot of videos. All the links are below in the description where you can find Jaymie and Maria and how to find them, and everything is so you can look more videos and get to know them better. And just I think individual approach, find somebody who you relate to, and you need individual approach, because this is the only way to balance your lives. Maria, I know you wanted to say something, please.
Yes,
Oh.
I agree in that sense. If you had something acute, because I worked in emergency, so I know how it means. I was on the road and not very for a very long time because it's exhausting. But anyway, if it's something acute, there is no time to
Yeah.
discuss. You have to get your surgery. It's done. That's it. I have to save you. Okay, but please consider always a second opinion, because we Western doctors, we are very inclined to tell it, yes, Mina, you need for 100%, you need that surgery, but you don't need it actually. Anyway,
Yeah.
so talk to a doctor that you trust, because there are good doctors out there. I hope
Yeah. Yeah.
there's
Yeah.
much more, and get their opinion. Because even if I tell you, well, you are a Virgo and all Virgos have the same problem, no, it's not like that. Okay, so first detox your brain with this control alt delete mechanism. Go outside, pet your pet.
Mm,
Go outside
yeah.
barefooted. Stay grounded. Do things that in you enjoy. Don't make things complicated, because we tend to make everything complicated all the time. Perhaps I'm
No, I
wrong. I
like. No, I like that. I like that. That's literally, I have a 4-year-old at home, and he's again teaching me how life can be so simple. When you look at life through the 4-year-old, it can be so simple. It doesn't have to be complicated at all, and I love that. Yeah, right.
It's going
It's
up
so
and down.
yeah,
So
yeah,
Yeah.
we have been to hell and back, each one of us, in one way or the other. Take the best out of it. We are here for a certain time, but please make really the best out of it, because we don't
yeah.
know what's tomorrow.
Yeah. Thank you so much, both of you. I think there were so many interesting gems and here. And please, everybody, if you want to learn more, go down to the description, connect with Jaymie and Maria, visit their Patreon page, follow them, learn, and find the way to make your life more balanced, for sure. I want to thank you both for your time and for
Yeah.
your knowledge and insights. It was beautiful combining, there's so many details, as you mentioned, each body part with astrology, each little vein has a different ruler and different planet. And so there's like so many different things, layers and layers. But it's so cool that there are people like you who combine multiple sources like astrology and our charts and our lifestyles and body and medical and Ayurveda together, and having this unique approach is great. Thank you so much. I appreciate it, your time and
Um,
everything. Yes, Jaymie, if
I'm
you want
sorry,
to say
can I say
something,
a really
please.
quick thing? Yes.
Yes.
For misbehaving or anyone else who's interested, but just since you were on here and asking questions, thank you so much. Maria and I would love to invite you to our Patreon, and you can ask one question. If you do the monthly one, you can ask one question every week. So that's 4 questions. You can also ask follow-up questions. Check out our YouTube channel where we talk about the different detoxes as well. And I would say, obviously, this is very general, but like since you have a lot of Sag in your chart, you do want to make sure that you're detoxing and cleansing in the proper order. But there are certain like things that people can do. We talk about 3 different detoxes that we recommend. So specifically for Sag, with liver, there's different things that you want to take a look at. We're talking about lower leg stuff. So there's a lot of times like women who have problems with like a reproductive system. There's circulatory issues with the lower legs.
Yeah.
So before maybe implementing new herbs, maybe looking at like detoxing, because if you're bringing in new stuff but your body isn't able to assimilate with it, it's not going to be the most effective. So check out that video and then join us on our Patreon channel where we can give you more specific information based on just getting more details about you. So, and that's
Absolutely.
also for everyone as well.
Absolutely, absolutely. Thank you so much. This has been a wonderful, wonderful chat. No problem. I was really happy and pleased, and thank you, Maria, for my assessment. It was I'm still processing. It's a lot of things, so I would highly recommend you get an assessment from Dr. Maria. It's full of gems, and I love it. So thank you again, both of you. Good luck with everything, and I hope many people will join, and you can help them with your knowledge. Thank you
Thank you.
all. Bye. See you soon.